So I lead the Clinical Quality Registry Policy team in the Commonwealth Department of Health. So I'd like to take the opportunity today to talk a little bit about clinical quality registries and the value that they deliver to our healthcare system. So I'm going to start by talking a little bit about what clinical registries are, the unique benefits they deliver to our health system, and then I want to talk a little bit about how we can really maximise their value through a national strategy. But first, I just want to talk a little bit about the context in which we're operating. So in the last few years, we've really seen growing recognition of the importance of patient-centred healthcare. And by that we mean healthcare that's respectful of and responsive to the individual needs, preferences and values of patients. So in 2017, the OECD released a ministerial statement on next generation health reforms, and it said that health systems need to fundamentally deliver improvements that matter to patients and that people-centred care should be guiding healthcare into the future. Then more locally in 2017, the Productivity Commission released a report called Shifting the Dial, and it recommended that all Australian governments reconfigure their health systems around these principles of patient-centred care, and we should do that within a 5-year time frame. Within this broader context as well, we've had 2 major Senate inquiries into medical devices in Australia and adverse outcomes on patients. And we've also got our Atlas of Healthcare Variation series that the Commission do, and that continues to show that there is variation experienced in care across Australia and that some of that care can be unwarranted. So as a result of all of this, we're seeing more and more focus on the value of understanding safety and quality in healthcare, but also in the value in delivering outcomes that matter the most to patients. So that's where clinical quality registries come in. They're one of a number of mechanisms that we can use to monitor safety and quality, but CQRs are data that are deliberately collected for measuring and clinical and patient outcomes. So they systematically monitor the quality of healthcare within a particular clinical domain, and they do that by routinely collecting, analysing and reporting longitudinal outcome data for a particular patient cohort or population. The registry then produces clinical quality indicators that are risk adjusted and benchmarked so they can see whether there's any variation in clinical care processes or in patient outcomes and experiences. They then feed that information directly back to the providers, including clinicians and hospitals, to enhance their clinical practice and decision making. So this helps drive a continuous cycle of improvement and helps to reduce any unwarranted variation in care. So it's this feedback loop that's a defining feature of a CQR. It's what sets CQRs aside from other quality mechanisms, including clinical audits, and it's where their return on investment is most realised. So in terms of what this means in practice, I thought I'd just give a couple of examples of some registries that are making really good real-life differences for patients. So the first example is the Victorian Prostate Cancer Outcomes Registry, and that's had a significant impact on the delivery of care for men with prostate cancer. So for example, it identified that a major Victorian hospital had higher than normal rates of positive surgical margins, so cancer cells left behind after surgery, and that was leading to a spike in secondary treatment. So by using this information from the registry and feeding that back to the society and the clinicians, that directly led to changes in training and supervision by the society and reductions in mortality and secondary treatment. And because the registry follows the outcomes of men post-surgery, they also found that they were experiencing poor quality of life. A lot of men were experiencing poor quality of life after prostate surgery, particularly around sexual, urinary and bowel function problems. And that was more than what had been expected. So as a result of the information fed back from the registry, we're now seeing rates of radical surgery for men with low-grade prostate cancer decreasing. The National Joint Replacement Registry is another high-performing Australian CQR. It's been going for nearly 20 years, or over 20 years, and it's achieved over $600 million in savings from reduced joint revision surgery. It was also instrumental in Australia being the first country back in 2009 to withdraw a particular metal-on-metal hip replacement device from the market because the registry was showing it was having a lot of adverse impacts on patients. So it's this CQR's ability to provide this actionable outcomes data that makes them unique. And we can't always get this information from other health data sets or through big data, so it provides that missing piece that we sometimes can't get from other information, and that's why they're so important. It's also this outcomes data that helps improve the value of healthcare generally and contributes to the sustainability of our healthcare system. And in fact, ICHOM has specifically identified CQRs as important vehicles for delivering value-based healthcare. And CQRs can also make that real-life difference in outcomes that matter to patients. So as we're seeing that healthcare interventions and treatments are reducing mortality, as it's the ultimate outcome measure, we now have the opportunity to focus more on those measures that matter to patients after they've received treatment. So things that we were talking about with the prostate cancer example, for instance, around quality of life, survivorship after cancer, and wellbeing. And CQRs can help us do that through the collection of patient-reported outcome and experience measures. Economically speaking, CQRs also deliver a significant return on investment. So there was a study done back in 2016 that looked at the economic impact of 5 Australian CQRs, and I think the PCOR and the Joint Replacement Registry were 2 of those. And that report found that CQRs delivered significant value for money when they were correctly implemented and they were sufficiently mature. It showed that they improved the value of healthcare delivery at relatively low cost. And most importantly, they delivered substantial benefits for patients, including greater survival, better quality of life, and avoided cost of unnecessary treatment or lengthy hospital stays. So in my personal view, I think it's an absolute no-brainer that we invest in CQRs, and thankfully my department thinks so too. So this is some of the few registries that we support in the Commonwealth. We fund 16 in total. We fund or partially fund 16 in total to the cost of about $7 million a year, which is not a lot when you think about it. And 6 of those registries are managed directly within my team. So altogether, we think that there are about 60 national and state and territory registries operating across Australia. And traditionally, these have evolved through a bottom-up approach where they've been clinician-led initiatives within a particular clinical domain. And while that approach has been really good in terms of having the necessary clinician engagement that we absolutely need for registries to work, what it's also meant is that we've now got a range of registries operating across the country for different reasons and purposes with different funding arrangements and not a lot of coordination at the national level. So this has led to quite a lot of inefficiency and duplication across the sector, and the absence of a strategic top-down approach has meant that it's been difficult to prioritise investment into those domains where it will have the greatest impact on patient outcomes and where the most return on investment can be realised. It's also limited the integration of CQR data into broader healthcare information systems. So we think that having a nationally coordinated approach will really help improve this, not just in terms of significant savings in the cost and time required to set up and run CQRs, but also to really add to that value of integrating them into our broader information systems. So that's where our national CQR strategy comes in, and that's what we're trying to do here, is to maximise the value of CQRs through a national coordinated approach. So there's two main ways we want to do this. The first is to help build capacity within the CQR sector to meet national standards and to really rise to that level that we see from some of our top performing CQRs. And then over the longer term, our long-term vision is to really embed national CQRs into our health information systems so they become part of everyday healthcare. So it's quite an ambitious strategy. We see it unfolding over 10 years and beyond, but we really want to push this sort of big agenda because we think that's where the value will really lie. So the strategy is being led by the Commonwealth and the state and territory governments together, and it's being overseen by the Australian Health Ministers Advisory Council and the COAG Health Council, and that's really important because that gives us a national platform that we need to make some of these really big changes. So we see the strategy as having a lot of value for a lot of different stakeholders, not just us in government, but for a whole range of different CQR beneficiaries, some of which we've listed here. So for instance, we think it will benefit patients, their families and carers through better care, better outcomes, and having more information to make better healthcare decisions. We think it will benefit clinicians through more targeted information to enhance their decision-making and practice and to deliver patient-centred care. And we think it will benefit hospitals, governments, funders and insurers through a safer, more sustainable health system and the reduction in unnecessary, ineffective treatment or adverse events. So how we plan to do all of this? Like I mentioned before, the first part is really around capacity building in the current sector and doing what we can to support CQRs to meet the national standards that are set out in the Commission's CQR framework. So this framework is widely recognised as Australia's best practice guide for how we should run and maintain CQRs. But what we've heard through our consultations on the strategy is that CQRs need more support in order to meet these standards consistently over time. So we're hoping through our strategy actions we can provide a range of support at the national level to help facilitate that. We also want to put in place a national funding framework to target investment in those clinical domains that I mentioned before that have the greatest burden of disease and cost to the health system. Now again, the Commission have put together an initial prioritised list that you can see here, but we're hearing that we need to regularly review this list to make sure we're capturing emerging priorities and any gaps that might be arising. So the strategy actions we're planning are around developing national prioritisation criteria with the Commission and having a transparent funding mechanism through which we can fund CQRs going forward. More broadly, what we really want to do is facilitate this gradual evolution of CQRs into patient-centred interactive health information systems. So this is really the heart of the strategy and what we really want to do. And we want to do that because there's good evidence that addressing patient needs and preferences in planning, design, delivery and evaluation of healthcare can lead to better health outcomes, experiences and greater efficiency of care for our patients. So this diagram depicts that all-important CQR feedback loop and where we can include the patient in that. So for instance, it shows that we could potentially have patients directly supplying their reported data to the CQR. We can then provide that information back to the patients, preferably in real time when we have the technology to do so, so they can see how their progress is tracking over time against particular interventions. And then they can use that information to have more informed discussions with their clinician and promote that shared decision making. So our strategy actions are designed to support the sector to collaborate more with patients, families and their carers in all aspects of CQR development and operation to ensure that that feedback loop is really providing our clinicians and providers with information that's patient-centred and reflects their lived experience. Next, we want to increase the value of CQR data by making it more accessible. So we recognise that the CQR information has a broad appeal to a whole range of different people. So we want to create an environment that supports broader access to tailored information for different stakeholders so they can use it to inform health policies, services and treatments, and improving the safety and quality of care. So strategy actions are designed to facilitate the resources and skill sets required for CQRs to provide this service to a broader range of people. We also want to create a transparent and accountable environment that supports more responsible public reporting. And by that we mean that more information on outcomes data is made available to a lot more people. Now we know that some of that information is already available through the Australian Institute of Health and Welfare's website and state and territory performance websites. But we think a greater amount of aggregate de-identified information from CQRs could be made available, and that could be really valuable for a lot of people. So we're designing actions that are going to pilot that approach with some mature CQRs to demonstrate that benefit. We also recognise that over time that there's potential to implement public reporting at the hospital and clinician level as well. And we know that the hip fracture registry, for example, is one registry that is already reporting outcomes data at the hospital level. But we also understand that CQRs must work extremely closely with their clinicians before making any change here. We know it's a particularly sensitive issue in Australia. And we know the hip fracture registry were very careful in their approach to doing this. They worked with their clinicians for a long period of time and used methods like shadow reporting for 2 years before they made anything public. And then finally, and most ambitiously, we want to see this clinical and patient outcome information integrated into our broader health systems. So this will considerably reduce the duplication that we're seeing and the cost and burden of collecting and storing multiple CQR datasets. So this is already routinely happening in many countries overseas, including Sweden, Denmark and the Netherlands. But in Australia, our CQR data still tends to exist in quite a siloed way without a lot of connection with each other or with other health data sets. And even when we have done that, so in Victoria, there's been a lot of really great work in linking CQR information with national data sets like MBS and PBS. Those other data sets aren't very well integrated either. So we're sort of up against it across the whole system. So our actions in the strategy will primarily look to form a bridge between the CQR and the broader data environment, and we'll centre on doing things like data linkage pilots between CQRs across these major health data sets and with electronic medical records, when they come on board. And really looking at those sort of interoperability with mobile devices and platforms that we can support more electronic collection and real-time reporting. So in terms of what this wonderful end state will look like, what we're hoping to achieve is that we want to see patients receiving equitable, high-quality care and being more empowered in their decision-making. So if we haven't made things better for patients, then we can't say that the strategy has worked. We want to see really strong networks of clinicians and other health providers working together, using this data to drive improvements and new and better ways of doing things. We want to see patient and clinical outcomes data collected and reported as business as usual and used in routine healthcare. And we want to see CQR data being accessed and used by those who need it, when they need it, to help improve patient outcomes. So in terms of where we're up to in this big process, we released our draft strategy for consultation last year. It went out for public consultation and we received a lot of feedback through that process. And we currently have updated our strategy document to reflect that feedback, and it's with our partners in the states and territories and our expert advisory group to review. Once we've finalised the high-level strategy, we'll then seek endorsement up through our health committees, up through COAG, and then we'll begin implementation activities.